listening to Maximize Living Radio. I'm Dr. Alex Pattison, on air with Dr. Aaron Greiner. And as always, this morning, we're here to teach you, to inspire you, and to coach you to your maximize living potential. This morning, we're going to talk about an extremely common problem. And because it's become a problem, so many Pittsburghers and so many Americans are beginning to think it's normal. In fact, just down the road a couple of weeks ago, we saw the perfect example of this. West Virginia's basketball coach, Bobby Huggins, collapsed, grabs his chest, his defibrillator went off during a basketball game. Turns out he's all right, and he's going to be okay, thank God. But after the game and he was being interviewed, he said, yeah, I have a problem that all men my age have. It's no big deal. It's very common. Well, while heart disease is an extremely common problem in the United States, it is by no means normal. And if you were like me, you were probably raised this way. When I was raised, I was told that you just have heart problems as you get older. All of them men in my family did, and that was just something that was going to happen to me. But the more that I studied the body, the more that we really began to understand how the body functions and heals, we see that heart disease is by no means a normal phenomenon. It just so happens to be a common phenomenon. So what we're going to give you this morning are the action steps and the insights in order to reproduce and recreate heart health like so many Pittsburghers have been able to do. If you suffer from high blood pressure, an arrhythmia, a cholesterol issue, or another diagnosed heart disease condition, you can't afford to miss a single second of this morning's program. If you're just tuning in, you're listening to Maximize Living Radio. We're discussing heart health, how to improve yours this morning. And I think the logical flow with what Dr. Aaron just went through is to kind of stick with this topic of where people tend to get their information when it comes to nutrition for heart health. And oftentimes, from what the newest research is showing, it's 180 degrees different than what they have previously been told or previously thought they should be consuming in order to improve their heart health. The average heart health recommendations that we see coming through our clinic doors are somebody that's told to avoid fats altogether and eat a diet that's high in refined carbohydrates. Now, what I'm looking at here is some research to show you that this may be for you the absolute worst recommendations that you could be following when it comes to your health, because here's the health consequences that will result when an individual avoids fats, the proper types of fats, and consumes a diet that's high in refined carbohydrates and sugars. The first one should scare you if you suffer from a heart disease, because it's an increase of coronary heart disease. If you already have coronary heart disease, it increases the mortality risk of a heart attack, and it also increases the overall mortality overall. So when our body moves away and it starts consuming these processed carbohydrates and these refined carbohydrates on a daily basis, on a regular basis, not only does heart disease go through the roof, but all sources of mortality increase as a result of that. It increases thrombogenic markers, which is a fancy scientific doctor's way of saying that it increases your chances of a stroke as a result of a clot. It increases the oxidation of your low density lipoproteins, which is the bad cholesterol. And it's actually the oxidation of cholesterol that causes heart disease. So this is a really drastic effect. If you suffer from heart disease, this oxidation of your bad cholesterol is truly the underlying cause of heart disease, and we need to be avoiding at all costs things that oxidize cholesterol. It increases inflammation, which not only increases your risk of heart disease, but all diseases in general. It impairs your glucose tolerance, which Dr. Aaron had just talked about. When our glucose levels and our insulin levels are thrown off, it moves us into a state of insulin resistance, which increases the propensity rates of heart disease and stroke. It increases your body fat, obesity, diabetes, and it also increases your risk for cancer. So what do we do? What if we've been told to consume a diet that's high in refined carbohydrates because we have a cholesterol issue, we have a blood pressure issue, we have a stroke or a heart attack in the past? Well, we want to follow what the research is showing. And one of the things that most of the people that come into our clinics are looking for and are already doing for their heart health is taking a fish oil supplement. Now, what I want you to understand when you're taking a fish oil supplement, really what you are taking is a good quality source of fat, because that fish oil fat is amazing for heart health. So it's not just the fish oil fat that's amazing for heart health, but the proper types of fat taken in the proper quantities at the proper time of the day can really begin to allow an individual who is dealing with a heart condition reduce the biomarkers of the oxidation of the LDL by decreasing the amount of inflammation inside of the body, by allowing blood sugar levels to begin to normalize, to decrease the incidence rates of a cardiovascular event, a heart attack, or a stroke. So it's imperative that we begin to put 1 and 2 together, that if fish oil is good for heart health, then we need to begin to look at other sources of good quality healthy fats that allow our body and allow our heart specifically to function and heal as it should. And we're going to be talking to you about those fats. We're going to be talking to you about a diet that is put together not by us, but by the most cutting-edge research on the face of the planet nutritionally in terms of heart health. And you're going to be discovering that at 2 different events coming up right here in Pittsburgh over the next couple of weeks. And in fact, if you haven't picked up on the theme of this morning's show, what we want to help you understand is a different view, a different viewpoint of heart disease. And I think it's really important that now more than ever, we really begin to have that different perspective, that different viewpoint on heart disease, because this disease has gone through the roof. In previous shows, we talked about a cardiologist not even existing in the 1950s because this was not a disease process that was killing Americans. To today, it's the most prevalent disease process on the face of the planet. It kills more people than cancer, almost 10 times more people than cancer. And we truly do not understand how to prevent this and how to overcome this as a society. So we want to change your viewpoint. And to give you a little scenario of what our mindset is at this particular event that we have coming up either tomorrow on March 6th is this. Little story I like to tell is, let's say a little old man, a little old woman pull into a full service gas station. I know there's not too many of those left anymore. And the man has the attendant who's filling up his gas say, oh, you know what, my windshield's all foggy, I can't see through it, can you clear it off? And the attendant says, absolutely. He clears it off. And the little old man looks at his wife and says, boy, I still can't see out of the windshield. It's still dirty. So he calls the attendant back over and says, hey, I still can't see out of this windshield. There's still speckles. Can you please clean it again? And the attendant comes over and cleans it off again. It's as clear can be, not a streak, not a speckle. The little old man looks at his wife again and says, honey, I still can't see out of this windshield. It's still messy. And he calls the attendant over one more time. And the attendant says, sir, can I do something for you? Can I help you out? I think I know what's going on. And the little old man says, absolutely. The attendant reaches in, takes the glasses off the little man's face and cleans them off, puts them back on the guy, and the guy says, oh my God, my windshield is clear. When it comes to your heart, when it comes to this specific disease, we as Americans are walking around with glasses on that are completely fogged over, and we're not seeing what it is that we need to see. We need to change your viewpoint. This is a lifestyle-induced disease, no matter what way you look at it, and the medical field will tell you the same thing. They'll look at you and tell you need to lose weight, you need to get your diabetes under control, you need to exercise, you need to avoid toxins, you need to sleep better, you need to manage your stress better. However, unfortunately, when you walk into the medical doctor's office, they don't have the solutions for you or the lifestyle action steps that you need to participate in order to reduce these lifestyle factors from creating a heart attack from developing or a stroke from developing inside of your body. What we want to do is not mask these problems with medications. We want to give you the lifestyle steps to allow you to overcome, to change your perspective, and to heal. If you're ready to do that, Monday, March 6th at 6:30 p.m. at Gianna Villa's Family Restaurant in the South Hills. Allow Pittsburghers to truly get the information, to get the resources that is changing lives. We're going to leave there with pages and pages and pages of notes to begin to increase your heart health, decrease the #1 cause of death, not only in Pittsburgh, not only in the United States, but worldwide, heart disease from taking place in your life and in a loved one's life. God bless. Have an amazing weekend. We hope to see you soon.